There is new hope for people who suffer from macular degeneration. It's a progressive eye disease, often robs people of their vision.
A local eye doctor is offering a new treatment, and his patients say they are seeing clearly again because of it.
I couldn't distinguish between dark brown and dark blue and black. And a lot of the colors were just real faded. Yellows, like on the markers, you know, that you underline your books with. The blue flowers in my yard were either I couldn't see them or they were just looked pale, almost white.
Jean was going through this tough time with one of her friends who also has macular degeneration. She was shocked to find out he was seeing better after seeking treatment from Dr. Julio Arroyo with Eye Health Consultants of Texas. That's when she decided it would be worth traveling from Belleville to Houston to find out if she's a candidate.
My plan was just not to go blind. That was the basic plan.
Here's what was causing Jean's problem. The macula in the retina controls 90% of vision. Dr. Arroyo says cells are supposed to repair the macula and make it new every 2 days. When that stops happening, vision is lost.
We make cells constantly. In order to make cells, we need oxygen, water, raw materials, including the fats, the amino acids, vitamins, and minerals, and a very important thing, which is energy. Energy in the right form and information. If one of those is missing, that's when we start having trouble.
That's why Dr. Arroyo developed a protocol called M-Sharp.
The treatment protocol consists of 3 different parts. One of them is we look at the epigenetics and methylation, and that means we look at the biochemistry process. We try to balance the biochemistry by looking at the genes that control the replication of cells. So having that information, we can actually design a personalized nutritional approach with very targeted nutraceuticals for that particular patient. Then we look at the energy part of things, and again, we use 2, even 3 different energy medicine devices that provide the energetic information.
He says she started seeing more clearly only a few days after treatment.
Everything is better. I'm more social, and you know, I'm more active, both in and out of the house, and I read more. I had gotten to where I skimmed things because it was so difficult to read, and I was using a magnifying glass. And now I can read.
No more magnifying glass. Jean's eyes are magnifying everything for her. We found a local doctor who believes that treating the underlying cause can halt the progression and hopefully enhance the vision. Douglas Perel and his wife Jeanette travel 6 hours all the way from South Texas to see Dr. Julio Arroyo at Eye Health Consultants in the Woodlands.
My eyesight was failing me, so I went to VA and the optometrist there. I said, I need to check my eyes. And when he checked them, he said, you have macular degeneration. And he said, there's no cure for it. And that's it. Glasses won't help you. So consequently, I followed through until I found out about Dr. Arroyo.
This is the first person who's given us any hope at all.
That's the whole retina. And a very tiny area here gets sick. So it gets sick because it can no longer make new cells.
Dr. Arroyo says that's because of chronic inflammation and a lack of circulation.
Many of these people have very poor absorption. As a matter of fact, most folks that have macular degeneration, they also have trouble in their gut. They have high hypochloremia. What that means is that the hydrochloric acid in their stomach is not there. They have been taking heartburn medications or others because they have chronic heartburn. They simply digest very poorly. We do not have a stomach that absorbs the nutrients. We don't break down protein into amino acids. We don't absorb the minerals and the vitamins. What's going to happen is that the nutrients are not getting to the right place.
Dr. Arroyo's patients are given supplements to rejuvenate those nutrients. He also offers light and pulse electromagnetic therapy.
We are sort of infusing that into the eyes because we know that that enhances the ability to improve blood flow and circulation. It kind of helps the cells to detoxify themselves. So that is very, very important in all this process.
At 91 years of age, Douglas believes the treatment has stopped his progression of disease. Plus, he can slightly see better after 1 month of treatments.
I probably won't be able to restore it to the original, but at least it'll restore some.
Very good.
And that's a blessing. Believe me, it's not fun to be blind.
Dr. Arroyo tracks the progression of his eyesight using state-of-the-art equipment. The sensors around the eyes pick up electric signals from the retina.
So what that machine does is to take, translate the electrical signals and tell us how well they are functioning.
Douglas and his wife are happy to see a difference and hope for even more progress.
If he can just do some of the things he wants to do, I would be thrilled to death.